And you've written extensively a few times about the toxic medical culture, both at JAPA, New England Journal of Medicine, the Journal Watch, yes. Can you speak to how toxic cultures affect patient care?
Yeah, I think that there's not a lot of evidence out there, but the evidence that we do have is pretty clear that treating each other poorly, being bullies in general, is bad for patients because it affects the people around us, sure, and our jobs have a lot of small factors that go into patient care. So if any one of those factors is thrown off by a toxic workplace, then it's going to affect the end result, which is the care that we give our patients. So, there's little things just like breaking down communication, and not being able to communicate leads to more errors. It also leads to errors that aren't fixed, even if they occur. So, communication breakdown, being worse at procedures because somebody is being uncivilized in the workplace is a documented phenomenon, and ultimately all of this coalesces into hospitals that have really bad care environments or really bad interpersonal environments give worse care. There's been great studies that look at simulations of resuscitations while people are insulting each other, and they don't go very well when that's going on. So if you care about your patients at all, then you have to care about your coworkers and you have to take care of them as well.
There's a big discussion on social media about physician burnout, and I'm sure that's not exclusive to physicians, but what is it about toxic medical cultures that contribute to that healthcare provider wellness?
Right now we're doing a lot of speculation in this area because we're only now beginning to look at this topic as something that's worthy of research and study. That being said, we know that the things that fall under that umbrella of burnout are closely related to a toxic workplace culture. Anxiety and depression, the tendency to quit your job, all of those things that we kind of call this potpourri of things that is burnout, it's all very closely linked to the culture itself. We talk about this in the context of physicians a lot, and certainly there's a lot of nurses out there, and there's been more research on physician and nurse behavior than there has been for PAs. But I think PAs have a very particular role in the world that puts them at risk for different types of burnout and different types of toxicity. We don't have the numbers that nurses do, whether that's in the country or whether that's in the practice setting. Sometimes you're the only PA. There's not another PA around to sort of relate to or vent to. And we don't have that inherent hierarchical power that physicians seem to. They still have some of that old school traditional influence and authority just by the virtue of being a physician. PAs don't really benefit from that. While we're admirable medical providers, we don't have a long history of having inherent authority just because we're PAs. We're seen as team players, and that's the way it should be. But that also means that we're at a disadvantage if somebody's being toxic towards us. We don't have so much of a power play to make. So I think that PAs, while we don't have a lot of data on it, may be at unique risk for burnout and may be uniquely exposed to toxicity in the workplace.
So my question for you is, PAs are fairly new in Canada, and like you said, I guess this does happen in the States where sometimes you're the only PA in that facility. It can be intimidating whether you're new or you've been established for a while. Sometimes cliques do form within healthcare environments.
Sure.
And whether there's seniority in the workplace or a power gradient that you do talk about, what's a way to address the us versus them kind of mentality in healthcare?
Yeah, it's so easy to kind of get into our tribalism, and I think sometimes people see that us versus them as an opportunity to bond. Our team can get closer because we don't like that surgery team over there, or maybe, me and this other PA can kind of bond over how much we dislike this other person we work with. And that's very tempting, but it's very toxic. And really, healthcare is great because we already have common ground to bond on. We have patient care. So we don't need to create these artificial divisions between a team to kind of have somebody to root for. We're rooting for our patients at all times. So I think just remembering that we're all going into this building or going into an exam room or going into an operating room for the same reason, and that alone is something to bond over. So I think shifting the perspective from, what can we kind of get our team excited about from an adversarial standpoint to a really cohesive, patient care-centered perspective is important.
Mm-hmm. You also mentioned in your talk about the effect of witnessing destructive behavior. Can you talk to what the effect is on providers?
This has been looked at in a few areas, and there was a great study out of the UK's NHS that looked at thousands of healthcare workers and kind of the effects of negative behavior on them. It turns out that merely witnessing toxic behavior can have some of the same outcomes as being the bully or being the target of that toxic behavior itself. So things like intent to leave your job, basically turnover, quitting, can happen even if you're never actually targeted yourself, because watching people get bullied, watching people be cruel to each other is almost as bad as being the victim of it. It makes you not trust your colleagues. It makes you not trust your workplace environment. It makes you lose faith in your leadership, your administration, for not doing something about it. So all of these things can make the witnesses of this behavior, just as at risk for things like quitting and worse than being the target of it can.
It does cost the healthcare system money. Can you speak to that?
Part of the myth about bullies or toxic people in the workplace is that if they're good enough, if they're smart enough, if they're productive enough, it kind of outweighs all of the negative things they bring to the table, and that's just not true. Because people affect everyone around them with their behavior, you can quickly rack up a pretty big price tag on toxic behavior. And so somebody who's marginally more productive than those around them can give huge deficits to the productivity of everyone that they're mean to, everyone that they bully, everyone that is exposed to their toxic behavior. So if somebody quits their job, it costs a lot of money to replace them, 1.5 to 2.5 times their salary. That adds up pretty quickly just from turnover alone. But there's other things like wasted time and energy. People, instead of caring for patients and being productive in the workplace, they're deflecting, they're avoiding, they're dodging some of this behavior that's going on. So you lose money from those opportunities. And then there's all of the really bad things like medical errors and sentinel events. We think of those in terms of the human cost, of course, but don't forget that it costs money if bad things are happening clinically in your place of work. So there's a big price tag that gets racked up. One group of radiologists tried to add up this cost in their community hospital and came up with about $1 million a year that they could find in money purely lost to toxic behavior. Mm-hmm. And so that was a pretty shocking figure to see, but I think it's actually far higher than that in some of the bigger institutions.
Yeah, I'm just recalling the picture slide that you had of the cockroach in a bowl of, was it bananas or cherries?
It was cherries, yeah.
Yeah, and how the fact that even just having the one cockroach will kind of affect your taste.
Yeah, negative behavior is contagious, and mm-hmm. It magnifies itself. One incident can have a far greater impact than all of the positive incidents that preceded that. So I think it's important for us to remember that this type of behavior can get out of control, and there's things like victims themselves becoming bullies that perpetuates a cycle. So it's something that even allowing a little bit of toxicity in your workplace can end up costing you in big ways in the long term.
Mm-hmm. And can you describe that metaphor that you used about the clinical use of buffering and how that relates to
Yeah, I mean, the slide that you're talking about had a bottle of sodium bicarbonate on it. We use bicarb in the ICU all the time, and really it's a good drug to quickly reverse acidosis, but it doesn't do much. When your patient's crashing on you, you can pump them full of bicarb and their blood pressure looks better for a little while. Their lab work looks a little bit better. That pH on their ABG looks a little bit better. But as soon as it wears off, if you haven't corrected the underlying issue, that patient is just as sick as they were a few minutes ago, and you've done nothing but buffer them.
Can you speak to what you meant by don't be a buffer?
Yeah, I think this is a really common situation that people find themselves in. They consider themselves a good person and want to help their colleagues, so when they see toxic behavior going on, they try to stand in the way of it in some way, shape, or form. And I don't mean that in that they call it out. They are standing in the way to deflect it, to buffer it. They may make jokes to try to diffuse a situation. They may try to distract a bully from some of their easier targets. They may end up just trying to do the work that is no longer being done because of the toxicity going on around them. And essentially they're sweeping the behavior under the rug. It's tempting because it seems like the right thing to do at times. In the short term, it makes the situation a little bit better, but in the long term, it covers up the behavior. It protects protects the perpetrator as much as it protects the victim, and it prevents anyone from actually, exposing the problem and then correcting it. So what you'll find is that a buffer, not only are they wasting their own time by spending all that energy buffering somebody, they're preventing the system from correcting itself. So a benevolent intent maybe, but the outcome is not good.